Hello, everyone, and welcome back to another installment of Let's Keep Moving with the APDA. My name is Teresa Baker, and I am one of the physical therapists at the team at Boston University. And here's some of our contact information. If anyone would like to get in touch with us via social media, we would certainly love it. I know you've joined us through several of these Let's Keep Moving series. Today, what we'd like to do is talk about frequently asked questions that we receive all the time or we talk about in our clinic about exercise and physical therapy. I know if you've had a chance to join us in the past, you know that we work together with a team at Boston University. This is our team. And again, this is our contact information. And we would certainly love it if you were in touch with us on social media. So, the general topic of today is the idea of frequently asked questions that we've received over time. And I think one thing I want to mention today is that we have a presentation that we'd like to get through, but one of the most important things is that we'd like to know what questions you have. And I think maybe if we go to the next slide, um, this is the topic for the day, and we are going through some of the common questions that we get all the time. But via the chat feature in the presentation today, please feel free to type in a question that you might have, and we hope we can have a discussion towards the end of the presentation today. We also have the ability to kind of ask some questions as we're going through, and I'm curious what people on the broadcast have experienced themselves with some of these very common topics. So one of the first questions that we get quite a bit is, how can I find a physical therapist who is familiar with Parkinson's? And there's several answers to that question. One of the first things that I might encourage people is to start with your own neurologist's office. It can be very typical that a neurologist may have kind of an awareness in the local community of physical therapists that tend to specialize or see a lot of people with Parkinson's. And as you'll be seeing your neurologist very frequently, it's nice to have kind of a collaborative effort if that neurologist's office is used to working with other physical therapists in the area. Another thing that I'd like to mention is that the APDA, as a national organization, has chapter offices in every state. So the local chapter of American Parkinson Disease Association may also have some contacts in the local area of physical therapists who commonly work with people with Parkinson's. Another avenue in a local setting might be local support groups. People who've worked with different physical therapists may be able to kind of give their recommendations for people who other physical therapists who've worked with their loved ones or themselves. Another avenue to finding a physical therapist in your area who's familiar with Parkinson's is here at our center at Boston University. We're part of the APDA Resource and Referral Exercise Helpline, but within that helpline, we do specialize in trying to connect people with physical therapists in their area that might, again, have this specialty or have some knowledge of working with people with Parkinson's. So you can see that 1-800 number, and I know we'll link to it again throughout the broadcast. It's a toll-free number that we can be reached on. And then we also have an email address, which is rehab@bu.edu. Which is another way to get in touch with us on the exercise helpline and also for the specific question of finding a physical therapist in your area. Another resource that I'd like to mention is the American Physical Therapy Association, which is the accrediting agency for all physical therapists in the country, has another version of a website to find a physical therapist in someone's area. It's actually called Find a PT, and you can see the link below. So if you are able to click that link, what will come up is kind of a menu of choice about what state someone lives in, what specialty of physical therapy that they might be looking at, and then perhaps what setting that someone might be looking at. So I will also comment that physical therapists can specialize in certain areas of practice similar in a way to how physicians might specialize. So certain physical therapists hold a board certification in neurologic-based physical therapy. So it means that they have some additional training and they have some expertise in helping people who have neurological conditions, including Parkinson's. So on this American Physical Therapy website, um, choosing the neurology specialty indicates that it's a physical therapist who has additional certification in this area. And then the idea of a hospital outpatient physical therapy facility, the chances are physical therapists that have more neurologic based specialties often are located in these hospital outpatient based facilities. So if there's really not a great, someone doesn't really have a great idea of where to start, starting at one of your local hospitals, outpatient physical therapy facility might be one of your best bets. But again, we here at Boston University are very interested in helping people with the specific questions. So please don't hesitate to call our toll-free number and or email us at rehab.edu, rehab@bu.edu to kind of answer this question. So again, kind of moving through these frequently based questions, or frequently asked questions. Once someone has found a physical therapist that may have specialty with Parkinson's and they're ready to go to their first physical therapy appointment, what to expect at that first physical therapy appointment. And I will also reference some of our past Let's Keep Moving presentations answer some of these questions in greater detail. So for example, last month, Nick presented a Let's Keep Moving series about how to be proactive with physical therapy. So we covered a lot of great information and some similar to what we're talking about today. But on the first physical therapy appointment, the physical therapist will start with a discussion asking you to kind of describe your Parkinson's symptoms and how they're impacting your daily activities. They would like to know the history sort of your Parkinson's diagnosis and how you've been treated medicinally in the past, maybe other physical therapy that you've been to. A very important part of the first physical therapy appointment is understanding what are the goals that someone would like to achieve in physical therapy. That really drives a lot of the examination and a lot of the exercise prescription. Some other questions the physical therapist might ask are, what is somebody already doing for an exercise routine? And then what have they perhaps done in the past that they might enjoy? So another question people come to us with is knowing that they're going to their first physical therapy appointment, how can they best prepare? So for this discussion history section, one great way to prepare is to kind of gather your thoughts on how do you think physical therapy could help in your daily life, and what would you want to achieve or improve, or what would you want to accomplish? Having those thoughts kind of together and being able to contribute that to the discussion is very helpful in the first physical therapy appointment. Some of the other things to expect at a first physical therapy appointment is an examination. So a physical therapist, based on some of the information from the discussion, will examine someone's walking, their balance, posture, strength. All of these are going to go into developing a comprehensive exercise program. So a physical therapist really wants to have a great understanding of this. We have a past Let's Keep Moving series related to specifically to balance examination. So if there's kind of further questions about that, I can definitely refer back to some of the past Let's Keep Moving episodes. But again, another question that we'll get to that people will ask us is, knowing that there will be an examination in the first physical therapy appointment, how can someone best prepare for that? And so the answer to some of those questions are, first of all, wear comfortable clothing, something you feel comfortable moving around in, something you feel comfortable walking in. Wearing comfortable shoes for walking is extremely helpful. And sometimes that's noticeable when it gets to be warmer temperatures. Sometimes people are coming to appointments in sandals, and sometimes that's fine. But if there's another style comfortable shoe that's easier for you or more typical for you to walk with, if you have a chance to bring that to the physical therapy appointment, that's quite helpful. And then this won't apply to everyone, but if someone does use a walking device, even if they use it from time to time, if you bring that to your physical therapy appointment, that can be quite helpful because the physical therapist can see you with sort of what device is most typical for you. And so some of the other most typical questions that we get, and I would say probably the most typical a frequently asked question that we get is, what is the best exercise for Parkinson's or for someone with Parkinson's? Um, and I do have to answer that question is that there is no one single best exercise for Parkinson's because everyone with Parkinson's is so different. Physical therapists are healthcare professionals who will do an examination to try to understand the underlying movement problems that someone's facing and then design and prescribe a specific exercise program tailored to the needs of that person. So there's no one best exercise for people with Parkinson's. An effective program really needs to be tailored to that person. But having said that, an exercise program or the best exercise for someone with Parkinson's definitely depends on how someone is presenting with some of their movement issues. For example, some people that have more problems with balance may benefit from more balance intensive training. Um, Another consideration is, what does someone enjoy? So the best exercise is really going to include something that someone enjoys, something that's safe for that person, and then given that individual person knowing what they would enjoy, what they would stick to, all of those are going to be components of sort of an optimal exercise program. Now, having said that there's no one single best exercise for people with Parkinson's, we do know that there are several broader categories of exercise that the research kind of suggests are effective elements of an optimal exercise program. And in several past Let's Keep Moving series, Tim and Nick and I shared some information about these in more detail about these components of optimal elements of an exercise program, the optimal dosage, and then Nick gave a very specific presentation about how to stay motivated. So if there's kind of further questions in these areas, I definitely want to refer you again to some of the past Let's Keep Moving presentations. However, having said all that, we know that for an exercise program to be comprehensive, there really should be an element of aerobic activity, and there should be at least sort of a moderate intensity level of aerobic activity. Strength training should be another component. There really should be a strength training program that has a moderate level of challenge and one that also gets progressed over time. We know flexibility training it can be extremely important to kind of keep range of motion, to keep someone flexible and able to be active in their other activities. And that is going to be very dependent on the individual person in terms of what muscles need sort of the most stretching and flexibility training. And again, we know that balance training is an important component, and that very much needs to be tailored to the considerations of the person in front of us. So sometimes what people will say to us commonly is, given all of this information, how could someone really turn this into an exercise program? And that really does take a physical therapist to kind of work together to provide and work together to establish and provide specific recommendations. So we here recommend a model of care that we'll call the secondary prevention model. And this is kind of in that category of people will say, well, how can physical therapy really work best for me? Again, we feel strongly that at the point of someone's diagnosis with Parkinson's, they should be referred to physical therapy. But really, at any point in someone's kind of trajectory with Parkinson's, physical therapy referral can be quite effective. So in the first referral to physical therapy, as we've covered briefly, there will be an examination. And that information will kind of go into establishing a very tailored program for someone with their physical therapy. And that may take a couple sessions or several weeks to work together. That will be very individualistic. But at a certain point, an episode of physical therapy will wind down and come to an end. And then there will often be this in-between time. In between time meaning in between bouts of physical therapy. And that's really a time where people can effectively try to continue with the exercise program as prescribed by the physical therapist. But also, this is a time where sometimes it's very effective to have, say, other exercise classes. Perhaps this is where someone is really ramping up, say, a boxing class or yoga class. And maybe this is also another time where someone is really prioritizing their time at the gym. So these in between times, in between the physical therapy rounds, exercise really needs to keep up and keep going. And then often there's another episode of physical therapy or a check-in where there's a re-examination. This can be a time where the exercise program is reviewed, can be possibly adjusted depending on what's going on with someone. And then again, that episode might come to an end. So there's this in-between time to really keep up with the exercise program. And you can kind of see the cycle that we kind of prescribe again as this secondary prevention model. And Nick talked about this in the last Let's Keep Moving series. We often commonly call this the dental model, where you know that you check in, say, with your dental hygienist every 6 months. We believe that someone should be checking in with their physical therapist every 6 months or every certain amount of time. But in the in-between time, keeping up with their exercise program. So having said all that, sometimes people will say to us, I understand, I have my exercise program, but how to stay motivated or how to keep up with the exercise program. And this sometimes leads to kind of a larger discussion of, in the big picture, what what's important to someone? What does someone value? Sometimes people will say they really value independence, or they value freedom to be able to do as they wish in their life, or they value being there for their family. So with those kind of bigger pictures guiding the principle, sometimes people are able to use that as motivation to keep up with the exercise, knowing that the exercise program is designed to help people keep up with them, these bigger sort of categories that they value. Sometimes knowing the evidence that we get from the research, and the evidence for the benefit of exercise for people with Parkinson's is very strong. We know that the exercise evidence shows that there can be a slowing of the progression of the movement symptoms of Parkinson's. There's strong evidence suggesting that exercise may be neuroprotective for people with Parkinson's, may help improve cognition. So evidence is growing. It's growing as we speak, and the evidence really is so strong that really sometimes that's a way that kind of people can keep motivated. Knowing what the evidence shows is a way to stay with the exercise program. And then also say a component of this motivation is really knowing yourself, or perhaps knowing your partner if your partner is the one trying to keep up with exercise. A major component is, what does someone enjoy? Maybe can you think back to other times in your life where you've been able to keep up with exercise? What was working then? Um, Another component really is keeping up with what's easy to do. What's the simplest thing that doesn't really have any barriers in the way? And then another personal statement really is, what knowing yourself, what motivates you? Some people are very motivated to see the number of steps they get in a day or to check off something on a calendar. So this is very individualistic, but it's important to know and to really key in on what motivates someone, because that's going to be part of the way to keep up with the exercise program. So we also know from time to time, or people will kind of ask, what are some other tips to keep up with exercise? One that we get commonly is, as a question is, when should I exercise? Again, this is very personalized, but some people have a medication schedule where they often feel that there's times in the day where they feel their best, where they feel like they may have their most energy. That might be the time of day to really prioritize exercise. Some people will say in the mornings they really feel like they have their most energy, versus the afternoon's energy is kind of changing, or fatigue might set in. So again, the times of day where someone is feeling their best or maybe has the most energy is probably the best time of day to exercise. And then these are some other questions that we'll commonly get is, okay, well, what are some tips to stick with my exercise program? And you can see here, we've kind of touched upon this, what someone's larger goals are ways to stay with it. Some people thrive on accountability. So they know if they meeting a friend for a walk, or there's a class that starts on a certain time, a certain day, that they will be there. So that's an avenue to keep up with an exercise program. Some people also thrive on routine. So every Monday, Wednesday is a certain class, or say every Friday, that's when they're out for their walk. That works for some people. Then other people thrive on variety. So there's kind of a menu of choices they have in their list of exercises, and they like that variety and they can pick and choose. So I know we've covered quite a bit, and I'm curious for the audience today, what were some things that helped you stay motivated with your exercise program? Or any tips that you found especially helpful? If people have a chance to write in the chat today, we'd love to open up the discussion a little bit and to really kind of go over questions that people are raising, or maybe even just comment on things that have worked for people in the past. So having said all that, I know everyone knows that we're at Boston University, but we are here for everyone across the country through the support of the APDA. Again, this is our exercise helpline. This is the number, as you saw earlier. This is the email address. So we'd love for people to be in touch if there's a question related to exercise or finding a physical therapist in their area that might really be beneficial. So having said all that, we'd love to bring on Nick Wendell to kind of help us moderate questions from the presentation today. So Nick, great to see you.
Yes, and Teresa, thank you so much for such a, exciting and helpful presentation. And thanks you to everyone in the chat for writing in all of your great questions. And so hopefully we can get to a good number of them. If you guys are still thinking about other things that you wanted to know, feel free to continue to write in the chat and we'll get to as many as we can. So the first question that we had today, Teresa, was, I thought, a good one. This person said they used to exercise a lot, but haven't for a while. And we're wondering, how do you get back started?
That is such a great question. Thank you so much for asking that. And this is something I know we hear a bit in the clinic. People recognize they should be exercising. Sometimes they have in their past what they used to do. And sometimes that almost hangs over their head a little bit. It's saying that I used to be able to do this and this. And knowing that what they're able to do right now is a little different, sometimes can be a little unmotivating for people. But I will say this, is that we know it is never too late to get started with an exercise program. Of course, one of our strongest recommendations is to connect with a physical therapist to again have a very tailored, designed exercise program for you. And that will really be helpful to get started, and especially in some of these different categories of exercise. So the first suggestion would be connect with a physical therapist. If that seems like that's not possible right now for whatever reason, some other options may be virtual exercise classes. So APDA has on their website a number of virtual options for classes. So it might be a way people are able to try out different style exercises to see what might suit them to help kind of get started. One other tip I might say is to start gradually and to give yourself a lot of leeway, that this doesn't have to be an all or nothing. If I'm not getting every single category of exercise, that exercise is not worth it. No, that's not what we mean. But to start gradually and to try to really find something you enjoy.
That's great. That's great and really helpful. I think, kind of going off of that, a few different people have asked a version of this question. And so I wanted to, see what you thought, Teresa. Some people are trying to get back into exercise after various injuries or different symptoms, like a back injury, a fractured bone, or maybe some increased stiffness. Is there any recommendations for them?
Yes, yes. Thank you so much for that question. It's a great question, and it unfortunately can be very common if someone has had maybe an injury or perhaps a procedure or surgery. Coming back from that can seem a little daunting. Again, strong recommendation to connect with your physical therapist to see at that point in time what might be the best way to approach your exercise program. It might be that you have to ease into the exercise routine that you are doing. It might be that different style exercise, maybe perhaps a little more focused on different stretches if someone's finding themselves to be very tight, or to start the strengthening program maybe with different style exercises might be more appropriate. So again, we know that an injury or hospitalization or a procedure can take a toll on someone with Parkinson's, specifically related to their activities. So starting slow, gradual, and then connecting with a physical therapist to tailor starting back to the exercise program probably is one of my strongest suggestions.
Great,
Yeah.
great. We just had a question come right in from Steve Oppen. He said he was just wondering a little bit about freezing. I know there might be some resources we have available in past series, or some thoughts that you have.
Absolutely. Steve, thank you. Thank you so much for this question. It's so important and it's so common. And I just want to refer, in the past Let's Keep Moving series, Nick, I know you did a specific episode talking about strategies to manage freezing. But having said this, again, it is important to get the sense of what's kind of the pattern that someone's experiencing with freezing. Is it always getting started walking? Is it in certain areas? That also helps kind of down the road of tailoring the approach to very specific strategies. It could be that using certain style assistive device could be helpful. It could be that using maybe more, say, mental imagery is quite helpful, or using visual cues, such as lines that are taped on the floor, a laser pointer that kind of gives some visual cue to step to. It is a very common situation people are dealing with, and it needs a very individual approach.
Great, great.
Yeah.
Yeah, such a challenging thing, but one that can have a lot of positives if worked on.
Yeah.
Another question from Diane Tunis was asking, Teresa, what do you think about aqua therapy?
Diane, thank you so much for the question. And in the water, it takes a lot of pressure off the joints in the body. So for some people for whom, say, pain or stiffness or pressure is quite an issue, it can feel greater ease of movement in the water. The other thing I'll say in the water is that there's not as much of a concern of the risk of falling. So someone who perhaps loses balance in the water won't necessarily get hurt. They might get wet, but for some people that can really be an avenue to work on even more aerobic training in the water, and strength training, depending on sort of what's going on. Some people just find it more motivating. They know that, say, water aerobics class is something that they will attend. So for some people it can be quite beneficial. Some other people it might feel like one step too many. But for someone that's motivated or has the ability to try it, it might be a great opportunity to have another exercise class that feels that people can get some benefit from.
Definitely. I think that was a great question, and thank you
Yeah.
for that
Yeah.
answer, Teresa.
Yeah.
Douglas Arnold just put in a good question as well. Might a personal trainer be helpful keeping up with a program? And if so, are there common, personal trainers that might know a little bit about Parkinson's disease?
Yes, Douglas, thank you for that question. That's what a great question. So personal trainer is someone obviously that works with an individual client. Some personal trainers can have quite a bit of expertise when it comes to Parkinson's. And actually, the APDA has a very specific healthcare and fitness professional training program for people with Parkinson's. Some trainers have taken that class or have worked with people with Parkinson's for many years and are quite familiar. The nice thing about personal trainers is very personalized attention, and they're often not subject to the same regulations of insurance coverage that physical therapists might be. So sometimes we think of personal trainer as a very motivating and kind of a person that's right in your corner to help, perhaps in between times of physical therapy episodes. We think of a physical therapist as the healthcare professional that might look at the most broadly comprehensive look at sort of what underlying movement issues someone's dealing with. Personal trainer is someone that really helps keep up with an exercise routine and can be very effective and motivating to help people stay with their exercises.
Awesome. And there were a few comments that I thought I would want to highlight just because some people have some really good ideas or things that worked well for them, and everyone might kind of grow and learn from hearing from that. And so Frank Nothman said that he participates in Rocksteady boxing classes and finds that it gives him a lot of energy. So that is often a great strategy for people, different types of exercise class, with Rocksteady boxing being one that some people do, and there are many others. Another comment that I thought was helpful from Anne Green is that she is motivated by wanting to be able to hold her new grandbaby coming later this year. And so that, I think really comments to what you said, Teresa, of having things that motivate to help stick with an exercise routine. And then finally, Lynn Pauley said that she counts her steps and she thinks about exercise as a way of extending her life. I thought that was a really positive message and a great way to think about using exercise and keeping yourself accountable. So I thought those were really great comments.
Yeah, that's just wonderful. Thank you to everyone for that.
So we probably have time for, one more question. So we'll kind of keep them coming in the chat, but we're getting closer to the wrap up. And so I think, one final question that I thought was a really good one we might want to we might want to ask out loud was, if someone asked, I do want to join an exercise class, but wasn't sure what one would be the best one for them. And so I think that's a good question to maybe end on.
Yeah, that's a great question, and thank you for that. And so, again, just thinking about kind of goals or the big picture. So, in an exercise class, the best one for you is one that you would enjoy. Another component would be what's safe for you, yet perhaps challenging. So, some exercise classes can be quite vigorous, and different activities, standing, moving. Let's say, for example, boxing, as was referenced today. Some other styles might be a little less intensive, and there may be some options to perhaps do some of the exercises in a chair. For some people, that may be a safer option. I would say, what kind of class would you enjoy? What kind of class is local? What kind of class could you see yourself getting to that maybe isn't too far to get to? And what kind of thing do you feel like would say motivate you to get out the door to get to the class? So some of it, I think, is really looking at yourself to think, would I enjoy that? And some classes are very tailored for people with Parkinson, and someone with Parkinson maybe joining class for the first time. That might give them a lot of confidence that the instructor or the group understands people with Parkinson. So that may also be another consideration. So, Nick, thank you so much. And really, thank you to everyone on the broadcast today. We appreciate how willing people were to write in, to ask questions. And again, we here at Boston University are here for anyone through the, again, support of the APDA. So we appreciate your questions. We really look forward to hearing from people on the exercise helpline or to emailing us at BU. We also want to continue these Let's Keep Moving series. And so we look forward to seeing you later on this year with more of the broadcasts. In the meantime, we do want to encourage people to check out virtual events through APDA website to see what events are upcoming in their area. Again, we thank everyone so much for their participation, and we really look forward to seeing you again next time. Thank you.
Hi, I'm Leslie Chambers, the President and CEO of the American Parkinson Disease Association. Each month, across the country, APDA is providing support groups, exercise classes, and educational programs like this one to support the Parkinson's disease community. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. If you enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Your gift can help APDA support people living with PD through local programs, reliable resources, and groundbreaking research designed to find treatments and ultimately the cure for Parkinson's disease. Please donate today at apdaparkinson.org/donate. And thank you so much for your support.